This is Crystal Fenn with MedPage Today in Vancouver at the CHEST meeting, where researchers have reported promising results with the use of needle biopsy to determine lung cancer mutation status. For perspective on these findings, I turn to Dr. James Jett of National Jewish Hospital.
The promise of the study with mediastinal sampling of lymph nodes to get genetic testing is that it will change how you treat your patients. We are just learning of important genetic mutations that will dictate the best treatment, and two of the biggest examples are the EGFR mutations and the ALK mutation. And doctors need to have adequate tissue to do these samples. And sometimes a patient may recur from their cancer if they had an operation 2 years ago or 3 years ago and now have recurrence in the lymph nodes. So the treating doctor, the oncologist, needs to know, do they have the mutations or not? So with the EBUS, it's a simple bronchoscopy. It's an outpatient procedure. You can get samples of tissue to prove that they have cancer, and then you can do the mutations on these samples from this bronchoscopy and sampling the nodes. It's a very, very low risk procedure for patients, and the amount of information could make a dramatic difference in how you treat that patient.
The technology still has some limitations, but ones that can be overcome according to Jett.
And I think this is exactly the way the field is going. The limitation now still is the number of places that are doing these EBUS bronchoscopies and then the adequacy of the samples that they're getting. But I think the bar is being raised now, and the major institutions are adopting this very quickly, and I think community practice is also going to follow, although it may take a few more years for the community to adopt it. Anybody who is trained in bronchoscopy, this is a very easy adaptation. The limitation there is they have to have the right equipment, and so the EBUS bronchoscope costs some money, and some hospitals are reluctant to buy the equipment. But basically, any hospital that's interested in delivering frontline medical care will have this type of equipment, and the pulmonary physician or the surgeon who is doing these procedures can easily adapt and get adequate tissue. What this study tells us is that what we got before with just a little lymph node aspiration and a cytology, that isn't quite adequate enough. We got to get more tissue, a little bit bigger tissue, but the same methodology, and test it for the mutations.
So needle aspiration has the potential to improve the rate of genetic mutation testing in lung cancer, with the potential to impact treatment. In Vancouver at the CHEST meeting, I'm Crystal Fenn, MedPage Today.